Well, hey guys, today I want to talk about the new acne treatment laser, Aviclear. I've gotten a lot of requests. Please talk about the new Aviclear laser. Is it worth it? We're going to get into what it is, how it works, what you might expect with this treatment, and how does it compare to what's already out there in terms of acne treatment. So Aviclear was FDA cleared for acne in 2022. So it's pretty new overall, but truthfully, it's been in development for decades. It's a technology that we really began to understand a long time ago, and it's just now come to fruition. So things take time. What exactly is it? It's a laser. It's a 1726 nanometer laser. So how does it work for acne? With acne, you have a few factors going on that contribute to the overall disease process. First of all, you have a problem with the skin cell turnover lining the pore. You get sticky skin cells stuck together, and that leads to the formation of a plugged pore known as a comedone. Then you have the role of sebum. The sebaceous oil gland drains into the pore, and for whatever reason, some people just make more oil compared to other people, and this is under the influence not just of your genetics, but also your hormones. Increase in sebum plays a huge role because the third factor in acne overall is a little bacteria that resides down in the pore called Cutibacterium acne. Once that pore that's plugged up fills with oil, well, that bacteria breaks down that oil and releases inflammatory mediators, and that's what leads to red pimples that can be painful, they can be deep, and if left untreated, acne, of course, can go on to scar. Not only that, but in people who have a deeper skin tone, acne is known to leave behind a dark mark that can last for a good long time and takes even longer to get rid of in comparison to the actual acne itself, which is really frustrating. So here comes this new acne laser. How does it work? Well, it specifically targets the cells that make up the oil gland to basically destroy them so that in effect it cuts down on oil production. The nice thing about this laser treatment is that it is safe to use in all skin types and all skin tones. As you know from many of my videos, certain lasers and light-based devices do come with a risk of leading to burns in people who have a deeper skin tone, as well as hyperpigmentation. So the selection of laser and light-based treatments has to be, has to take somebody's skin tone into account. The nice thing about this laser is that it is safe to use in all skin tones and skin types. The other nice thing about this is that it also can treat acne that is primarily consisting of blackheads and whiteheads. That's known as comedonal acne. Not only can this laser treat active acne breakouts, but it also can prevent future breakouts, as you can imagine, because it is selectively targeting those cells that make up the oil gland. It offers the ability to lead to sustained clearance and fewer breakouts. And as you can imagine, anything that helps to clear up and prevent breakouts is also going to be beneficial secondarily in preventing the formation of post-inflammatory hyperpigmentation, or those dark spots that are left behind once acne heals. For a lot of people who have tried this treatment, their acne seems to clear up completely. But for other people, that's not necessarily the case. But as it stands now, it appears that not only can this laser clear up existing breakouts, prevent future breakouts, but the breakouts that you have in the future after having this laser treatment, they're shorter in duration, they happen less frequently, and overall are less severe. So that's good because less severe, less frequent breakouts, less likely to have scarring, easier to control, and less likely to deal with as much post-inflammatory hyperpigmentation. When you're not breaking out as severely, there's less inflammation in the skin to lead to that really stubborn discoloration. And if I didn't already mention, one advantage of this treatment is that not only can it be used to treat acne on the face, but it also can be used to treat acne on the body. A lot of our topical acne treatments, their efficacy on the body, like the chest, the back, kind of variable. This new laser treatment is attractive to people because putting on acne medications on your skin typically requires you to continue using those acne creams, acne treatments. People would love something that they would have to maybe cut down on the frequency with which they use those. That being said, while this can help clear up acne for people, not everyone experiences complete cure with this treatment. So it is possible that you will still continue to have breakouts, although hopefully it'll be less frequent and less intense. But if that's the case, then yeah, you will still need to continue some sort of acne treatment, whether it be a topical acne treatment that you put on your skin or one that you take by mouth. It takes 3 months to complete the treatment, and in a moment I'll explain what all that entails. But about 80% of patients note at that 3 months after finishing the treatment that at least half of their acne is clear. Then by 6 months after the treatment has been completed, around 90% of people note an improvement in clearance of their acne. So it suggests that the benefits continue after you have completed the treatment, like there's ongoing benefit to be had. What might you expect with this treatment? Well, the current treatment protocol is to have patients come in once a month for a 30-minute treatment session for 3 months total. At the time of the treatment, you may notice right away the pimples get maybe a little red, but overall that redness fades away pretty quickly. You're not going to experience any crusting, blistering. This treatment can, however, be painful. You are fine to go about your day, go back to work. There's no downtime associated with this, so that's nice. Will you need some sort of maintenance treatment? As it stands now, that's a question that has not been answered. How does this compare to some of the other typical acne treatments? As it stands now, there are no comparison trials comparing this treatment versus the standard of care treatments that we have, whether it be topical retinoids, topical antibiotics, whether it be the topical medication clascoterone, brand name Winlevi, or whether it be an oral regimen with an oral antibiotic, spironolactone, isotretinoin. Isotretinoin is the acne treatment that has the potential to offer a cure. However, only 60% of patients experience that. The rest of the patients will either fail and require another round, or after the second round, they still don't experience clearance in their acne. And the groups of people who tend to be that way, tend to fail isotretinoin, typically are women who, maybe their acne is more favored by hormonal changes. Like I've said in my other videos, all acne has a hormonal component to it. But in adult women, it's clear that that's really a big driving force, is that hormonal issue. And so that's one reason why a lot of women fail isotretinoin. That being said, will a lot of adult women fail or require maintenance treatments with the Aviclear laser? Only time will tell. Up until this point in the video, you're probably thinking, what is there to lose with this treatment? It sounds really good. I mean, worst case scenario, my acne comes back. Well, one big downside of this treatment is it's not covered by insurance. Each treatment session is going to run you about $1,000 out of pocket. And then there's the issue of accessibility. Not every dermatologist is going to have this device in their office. For a dermatologist or any practitioner, acquiring a device is an investment. So don't be surprised if you find that your dermatologist maybe doesn't have this in their office, because as it stands now, there are no randomized controlled trials looking at this new device, let alone comparing it to standard treatments. So for a dermatologist to think about investing in this, they also have to think about, the cost of maintaining it. Is it going to offer something to their patients above and beyond what they already can offer them? If their patients are not able to afford it, then why would they go buy? You know what I'm saying? Like, don't be surprised if there aren't dermatologists out there who are waiting for more data before investing in it and investing in using it in their office. But as it stands now, it is looking really promising, a really attractive option, and a lot of patients are getting excellent results. Because there are no randomized controlled trials with this device, there's just a lot of unknowns in terms of long-term results and how it compares to standard treatments, what with it being so costly and access issues. combined with, again, the fact that there's no randomized controlled trials with this device, what you'll notice is that recently the American Academy of Dermatology published updated acne treatment guidelines where they review the literature behind all of our acne treatments, and they discuss that and the like, and they left out the 1726 nanometer laser specifically because there are no randomized controlled trials to guide recommendations on whether or not it should be offered and to what patients it should be offered. All in all though, it's a really exciting trajectory for acne treatment, especially since it offers the potential to cure acne for some people, doesn't come with a risk of hyperpigmentation. And another benefit of a light-based device such as this is that there's not going to be any systemic side effect like risks, with isotretinoin or an antibiotic or even spironolactone. While those medications are safe, they do have side effects associated with them. A lot of patients don't feel comfortable with those potential side effects. This, avoids exposing yourself systemically, your body, to a drug, and it also avoids exposing your skin long-term to certain topical medications that may either be drying or irritating, or that may interfere with your skin microbiome, such as a topical antibiotic, which we try and limit the duration of. Now, all that to say, it's not to say that this laser will open the door for you to never have to have another acne treatment, medication, topical, prescription again. But if it could cure your acne such that it doesn't come back, well, that would really free you, and long-term probably would be a lot more cost-effective. Anyway, y'all, that's what I can tell you about the Aviclear laser. Really exciting development. I look forward to there being more research down the road, more long-term experience with this. We will get, hopefully, answers to some of these unknowns that I posed here in today's video, but I hope it was informative. Do let me know in the comments if you have tried this new treatment. Is this something that your doctor has offered you in terms of acne treatment? What was your experience with it? Do share in the comments. The community in the comments is very valuable, so I hope you all enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.